Hello again. Now, South Africa's healthcare system is under growing pressure as more patients live with several chronic illnesses at the same time, while care is still largely organized around treating single conditions. Now, this is called multimorbidity, and doctors say this fragmented approach is making treatment more difficult for patients. Joining us in studio this morning is physician and internal medicine expert, Dr. Tumi Mtombeni. Doctor, good morning.
Good morning.
Thank you so much. Yeah,
Thank you so much for inviting me.
No rest for the healers, I suppose. Well, let's get straight to it. And just for those who've not heard the term multimorbidity, I mean, during COVID, we heard comorbidity. We heard you having maybe, like things like diabetes. But what exactly is multimorbidity, just to clarify for us?
Okay, just to clarify, multimorbidity means to have more than one chronic condition at the same time. So these are patients that are living with more than one condition. So particularly in South Africa, we're seeing patients living with infectious disease like HIV and diabetes at the same time.
Oh.
So this puts a patient in the position where they're taking multiple medications and needing often to see different specialists and different doctors. And uniquely in South Africa, we have something called the quadruple burden of disease. So we have the four major causes of mortality, which means death in South Africa, is infectious disease like HIV, non-communicable diseases like hypertension, diabetes, and cholesterol, and then maternal and child and neonatal deaths, and then trauma-related. So we're dealing with this in this country, multiple layers of conditions, and you're often finding one person, and we're saying most of the time, because now with the advent of ARVs, more people are living longer and also able to collect more illnesses.
And then are vulnerable to other illnesses. Do we see certain illnesses, Doc, that are commonly accompanied by others? Like you mentioned HIV, then you said diabetes, but often you'll see tuberculosis and HIV, or not to scare anybody, but from my understanding, lupus sufferers sometimes often end up with some form of cancer, commonly breast cancer. I'm not a doctor, you can correct me if I'm wrong. Are we seeing that they come in like certain bundles, if I have to put it that way, or are they just coincidental sometimes, or most of the time?
It's interesting that you ask it that way. So yes, there are certain bundles, as you would say. One of the more common ones that we are seeing, like I'm saying, is people living with HIV, because we are getting so much control with so many people on ARVs. But then we're also seeing a very steep rise in non-communicable diseases. So that's cancer, that's cardiovascular disease, heart attack, stroke,
all the autoimmune conditions that are
autoimmune conditions as well. So we're seeing a lot of that, and we're learning that all this low-grade inflammation from autoimmune disease does put a person at risk of cancer. And so we are seeing this quite commonly, and some of them are a bit random, but we are, like I said, we're seeing a lot more of the HIV and non-communicable diseases.
And for you to have reached out to us saying that this is a problem, it leads me to imagine that this is becoming worse. It is getting worse. Normally you'd associate things like this with old age. The older you get, okay, then you're taking sugar tablets, then you're taking blood pressure tablets, then it's old age. Are you seeing this now moving into younger age groups and in particular communities as well? Are you identifying that?
Yes, it's actually across the board, and what we're recognizing is we're getting the rise again of non-communicable diseases, and that's largely due to the lifestyle and social determinants of health. And we're actually seeing it in people who are living in lower socioeconomic status as well as the higher socioeconomic status. We're seeing that the rapid urbanization has led to people being more sedentary, which means they're not moving around as much as they used to, and having more access to what we call ultra-processed foods. And the stress and lack of sleep all actually affect us on an internal level.
So the impact from the healthcare system now, like we say, already we find our healthcare practitioners like yourself and nurses who are already battling to treat. I mean, resources are slim to treat one illness. What is this doing in terms of taking care of these particular patients and others who come with just one illness?
Yeah, it's actually quite a burden on, again, both sides of the healthcare system. On the private side, where you've got a lot of access to healthcare, you find one patient with 4 different specialists because it's very much operating in that silo. So you find this one patient with 4 different specialists on multiple medications, and they're having complications of one over the other. And then in the public healthcare system, we're also finding that because we're primarily primary care, some of the primary care doctors and nurses are overwhelmed by the burden. Yes, we do have models that try and do integrated chronic care, but it is an overwhelming pressure.
And since funding cuts in terms of medical, like PEPFAR, and what we saw, what was this, just almost a year ago, right? Am I right? So it's around there. That must make things even more difficult. So what are we seeing as a result? Are we seeing more people dying unnecessarily from, like, this is taking its toll in that way, that it's becoming fatal, it's deadly for most people? Because obviously, like you say, you're seeing them across different income groups. In the lower ones, how many people can afford to see 4 different specialists?
Yeah, so it is quite burdensome, especially when you're in the major city centres. We're seeing that the tertiary level hospitals are also taking a large load, but also sadly a lot of people out in the periphery and rural areas are just not getting the access that's necessary. And with the growing shortage of doctors, including specialists, we're finding a lot of specialists are even unemployed up until today. So across the board, it is quite strenuous on the healthcare system, and a lot gets missed along the way.
Oh, sounds very scary indeed. So I think even more impetus for us to take care of ourselves, but let's hope there's a solution somewhere on the horizon as we settle. Thanks very much for your time this morning, and that is Dr. Tumi Mashweshwe Mtombeni joining us here on the South African Morning.
Thank you.